they fixed her up.
I'm in the same boat.
And it's just a whole.
I'm in the same boat, man. I'm still in the game.
Oh, well, I got that.
Oh no, we.
All high fiving each other. They knew each other.
I wanted to.
I'll call everyone to the meeting to order. 2020 regular meeting of the Haywood County Board of Commissioners. And our first order of business will be our pledge. And after that, I'm going to ask for a moment of silence. Pastor Josh couldn't be here tonight. And I'll ask for a moment of silence if y'all would remember our country during that time. So if we'd please stand for the pledge. Thank you. Okay, our next order of business is our public hearings, and we have none tonight. And the next is our public comment session. And is there anyone here that would like to address the board at this time? Okay, seeing no one, I'll close that portion of our meeting.
Kevin, I just want to make sure the front door is unlocked, right? I mean, people could come in. Okay. All right, thank you.
Okay.
I just didn't know. I knew we'd had it locked, so I just...
Yeah. It's rare we don't have public comment, but it's a cold day.
Yeah, I wasn't saying that as a joke. I was really asking. Seriously.
Okay, our next order of business is constituent concerns, and does anyone have any constituent concerns they want to speak to? You got anything, Tommy?
The only thing I might make mention of is we had the North Carolina Association of County Commissioners Legislative Goals Conference last week. And I do want to report that on general government, our #1 legislative goal as county commissioners all across the state was, I'll read it, seek legislation, funding, and other efforts to expand digital infrastructure and broadband capability to the unserved and underserved areas and residents of the state. And I did submit that goal a few months ago, and apparently there were several others, but that was our #1 goal, to have our association lobby the legislature to try to go ahead and secure more funding for areas like Haywood County that have some huge obstacles for broadband ability. So hopefully we can go somewhere there. We're pushing a little bit on that, and hopefully we can, with the latest tier designation that we got, I think we'll be in a little more favorable position. So we're still trying. Keep trying.
Okay, that's great. That's great. Okay, you got anything, Brandon?
Yeah. Okay. I guess just to add to that, I think we know one legislator used to sit right down here. So hopefully we can make some phone calls to him and see if he can push for that as well. But I did have a couple I got with Mr. Morehead on. One of the ones I may have Garen address when he gives us an update. But I got a call about the vaccinations, and if we couldn't put out some kind of a list so they would know where they're at on that list. So I'll have Garen address that if he don't mind when he comes up and gives us an update. And then the other concern I have, we've already addressed. So.
Okay, thank you, Brian. You have anything, Kirk?
I don't have anything.
Jennifer, you got anything?
The only thing I've heard was about the vaccinations, and I think Garen's going to weigh in on that in a little bit. And so we'll hear about that then.
Okay. Okay. All right. And I don't really have anything. So our next order of business is administrative agency reports and presentations. And we have our Health Director, Garen Bradish, here tonight to talk about that, the COVID-19 update. And welcome, Garen. Appreciate you coming out tonight.
Vaccine update. All right. Okay. So today we finished up our original allotment of 1,600 doses of Moderna that we received. We had a small clinic there at the health department. I think now we do have about 20 doses left over from today from some no-shows and things like that. So going forward, today we accepted a transfer from Haywood Regional Medical of 1,675 doses of Pfizer. Our plan is to try to move through that literally in the next 2 days. So we're going to plan a drive-through clinic tomorrow at the fairgrounds for the first 675, and then we'll have a larger clinic the following day to try to move through the 1,000. That being said, there was one of the comments that may have come up is kind of through the list of what we're doing. So we've now taken our list, we're looking at our 75 and older, and we're truly going down the list from the date stamps of when people registered, so that we're getting to those who registered first and then work our way back. So hopefully those that have been waiting the longest will be able to get the notification to show up to these 2 clinics. One of the other things that has come up with the state is North Carolina's fell behind compared to some of the other states in the amount of vaccine that we've distributed. So we are expecting another shipment of Moderna this week, possibly tomorrow. The plan is going to be, from going forward with the state, is to have 7 days. Wednesday will be your first day, ended up on Tuesday. That means whatever we're allocated, they're asking us to try to push it out in 1 week and have it all into CVMS so that we are not hit on our second shipment. This is how they're going to monitor how much the counties are doing. So we are going to receive 900 first doses this week, and we will have to plan, now that we've taken this from the hospital, through literally Friday through Tuesday in some way. So we're going to start with trying to register into our system. 3,000 of those were over 75. So hopefully this will get us through a large part of that older group in a quick amount of time. And then we'll move into our next phases, which will be the 65 to 75. Some of those have received some vaccine and have been worked into what we're doing, but we are specifically targeting that 75 and older that has been on the list the longest to try to get them through. I've taken a lot of phone calls, and I know that's who we need to get to, and we don't want to do this in some sort of randomized lottery type thing. We want to truly go in order of how people registered. That being said, have you got any, I know you had some concerns, go ahead and.
Just one that I might get you to touch on, Garen. I know that the question that was asked of me is why we couldn't put out a list, and I understand that we don't find out from the state until hours before we're actually getting that. So do you mind to explain that a little bit?
Hopefully with some of the meetings that have occurred today that I was on with the state, they are going to give us a little better notice of how much vaccine and when to expect it so that we can plan ahead. That was one of the big things that was discussed, is not knowing how much we're going to get in the shipment and exactly when the shipment's going to arrive. So they are planning on trying to come up with a very consistent way of doing this. How much vaccine, like I said, we receive depends on how much we administer in a 7-day time period each week. As far as our list, are you referring to people being on the list and when they can expect it?
Yeah, the question was, you know, it was an elderly couple, and they said, hey, we would like to know where we're at on that list, if it's going to be weeks out, if it's going to be this week. If we knew where we were at, then we could plan accordingly. And the other question was, you know, hey, can we come as a couple? And I think we're encouraging that as well.
Yes, we are accepting anyone that comes as a couple, so that to make it easier on people to be able to move and come to these clinics. So that's something we've already been doing. And yes, we are planning having a meeting Friday of this week, and one of the things we want to discuss is moving through the phases, and what we're looking at is timelines, and be able to track that with how we've registered. I've had some calls from the schools, when are you going to get to our employees and things like that. And so we're starting to develop those plans looking just a few weeks ahead of possibly sending out school nurses in teams and saying, all right, we're going to hit this school on these days, and operate in those fashions. And then look at other essential businesses and how we reach out to those businesses and give them a heads up. Your time's coming in the next 2 weeks. Or I think it's going to require some weekly press releases to kind of keep people informed of how we move through these phases and what they can expect.
How about our employees who deal with the public? Where do they fall on the list?
Well, as far as public health, we've gotten quite a few of them done. We have worked with some of the social workers that go into in-home visits and got them vaccinated. So a lot of those frontline workers we've got. Now, one thing we do have to get caught up on is our law enforcement. We originally had tried to get them earlier on, but when the state changed some of the criteria and they actually moved them to a date of the 20th of this month to start, we will be working them through. One of the things we run into with anything with the vaccine is within your vials you'll have extra doses, or at the end of the day we have some doses left over. We've compiled lists of law enforcement and others that we can call and say, can you be at this clinic in 30 minutes? We've got 10, 15 extra doses, and we need to give them out. So it's easier than trying to reach out to the public when we have lists provided of county employees and such as law enforcement that we can call and say, hey, can you be here within half an hour? So.
Well, I would just encourage, if there are extras, that if we could get the county employees that actually meet with the public, and even in this building and other buildings that may actually engage with the public, so we could keep our offices open here, they might feel a little more comfortable about serving the public here.
Absolutely, yeah. We have lists of facilities and maintenance. We have a multiple lists throughout the county government that we can call on and say, hey, can you either be at the health department or at the fairgrounds? Yes.
Okay, thank you.
Garen, I was on a conference call last week with the governor and the Speaker of the House, Tim Moore, and both of them said across the state there had been counties that had actually wasted vaccine. They had maybe thought out 700 doses and only 680 people showed up, or 650. And they've stressed to us to, communicate to y'all to have a standby list. Maybe if you've got 700 people scheduled to come and only, 650 show up, well, you've got 50 doses there. And it may kind of go along with what Commissioner Kirkpatrick noted there, but do you have a standby list? Somebody maybe can get there within 30 minutes, or
we do.
What do you do? You do have that? Okay.
We do have those standby lists, and like at our last drive-through clinic, one of the things we did is we thawed what we had remaining of Moderna. We can hold it for 30 days after thawed in refrigeration. So as we would go through the clinic and we saw more and more coming in, we could run back, pull it from our refrigerator, have vials there ready to go. And then at the end of the day, we had 20-some, 30-some preloaded shots ready to go, and that's when we called on law enforcement from the different agencies and whatnot to come up so that no vaccine was wasted.
Good. Yeah, we don't want to waste any of that stuff.
It is a little bit of kind of working through the clinic. Literally, I kind of walk in lines between the cars and count people in the cars and call back towards the end of the day and say, okay, how are we looking, things like this, and kind of give an update so that we try not to schedule more people, obviously, than what we have in vaccine, but we always want to make sure that we've got enough there. I'd rather us have to call a waiting list at the end of the day and bring people in than definitely. We've not wasted any.
Right. Good.
So, first of all, let me say that I was on my first group conference call with other commissioners from other counties, and they were in awe of what we were able to do. And I don't know what you're hearing from your side, but, this is the first rollout that I've ever been a part of it, even in a removed level. And of all the people that reached out to me last week, no one had anything negative to say, and I think that's really to be congratulated for great leadership and boots on the ground, because it's a huge undertaking to have a drive-through, and these other commissioners were saying they didn't have the manpower, they didn't have the vaccines, they didn't have a location where they could do it, because we have a great facility at the fairgrounds. And so that's what I really wanted to say to you, is that, and to all the people that are participating, whether you're pro-vaccine or against the vaccine, to see all of our county agencies working together collectively, and 10 or 15 people go to the effort to say everybody was in a good mood and it ran very smoothly, and how much they appreciate it. I just want to say thank you for that, because that could have been a real interesting orientation for a new commissioner for it not to run smoothly. So I appreciate that very much.
Well, I appreciate it. Thank you. It will be evolving and changing, because we will, now that we've started with the drive-through clinics, As we enter into second dose, and now that we're working with 2 different vaccines, there will be that planning and coordinating of the second dose, and we'll have to do large drive-through type situations to be able to administer those doses. But the good thing about that is all the paperwork, which is the hardest part of this, will be done because those people will receive the first vaccine. So literally it's just getting them through, making sure they know the date and the place to be, and then just giving them the second dose.
Yeah, and Garen, I appreciate it. I think y'all have set the bar high on how to do this, and I agree with Jennifer. I've heard the same thing of other communities trying to figure out how to do it and the best way to do it, and I feel like we're on the cutting edge of the way you should do it. And I really appreciate the volunteers and all the agencies that have come together and to focus on just getting it done, if you will. So I appreciate that. And congratulations on that. I know, it takes a lot of planning to set up what y'all have done and everything. I was just wondering, on the Moderna, how many shots did you get of that, or do you want to say, and when will you be administering that?
Well, with Moderna, that's what the health departments have been receiving.
Right.
So up to this point, we had received 1,600 initial doses. Another 9 is expected to arrive tomorrow, and we have in our freezer 900 second doses, just for second dose.
Okay.
So that's currently where we see it. So we finished up the 1,600 minus 20 today. We have 900 more coming tomorrow, and then we have 900 for our second dose already ready.
Okay. And then when you go get it to the health department, how long does it take to thaw? You just leave it outside and it thaws out in a certain number of minutes, or is there, I was just curious what.
No, you can thaw it inside a refrigerator, and it's supposed to thaw in 2.5 hours. We found out at the drive-through clinic it takes about 4 in a refrigerator.
Okay.
But you can thaw it at room temperature, and you can do it in an hour.
Oh, okay, okay.
Now, there again, tomorrow and Thursday we'll be working with Pfizer, which is a little bit trickier.
Yeah.
That's the ultra-low cold, and it has to be mixed. But the hospital, since we've taken this from the hospital in this transfer, they are going to provide their pharmacists there. They're going to maintain the vaccine, be watching it over for us. They're even going to be doing some of the loading of the syringes for us because it is a little bit more delicate. And since they've had this for weeks now, they're used to it. And so the hospital's really going to come in and give us a big helping hand of getting through the next 2 days.
Okay. Well, that's another great partnership that we have then with the hospital, with them coming on board and doing that. And this just really shows how hard it is for you to do what you've got to do. You've got to get it there and thaw it out. It's got to be ready when people drive up. So you've got to have enough and get enough thawed without thawing too much to where you don't want to waste it. And then, you've got to get it administered and everything. And then they've got to come back 2 to 3 weeks or 4 weeks later and get that other dose. And so I can see the logistic nightmare, and y'all are really handling it well, I think, Gary.
The biggest hurdle in it for us, and public health has worked really well, and EMS has been great to partner with in carrying a heavy load with this and helping us plan this. The paperwork in the end, because everything has to go into that CVMS tool for the state. Until we have it entered there, we could put the shots in people's arms all day. The state doesn't see it. They don't see it until it's in that system. So that's the hardest part of the process is right there.
So people need to realize is after they get the shot, you guys are doing a ton of paperwork on just every person that comes through there. And I mean, it's just one person, there's no telling how much time you spend per person doing, I mean, if you added it all up per person and everything to see how enormous the effort is and how successful y'all have been at it. So it's great what y'all are doing.
I see Dr. Jaben's arrived, so I'll turn it over to him.
Welcome, Dr. Jaben.
Hello, everybody. It's a pleasure to be in front of a quiet crowd, so I know you guys appreciate that. So the good news is that Haywood County currently, as of today, out of 100 counties in North Carolina, we're the 75th lowest in terms of rate of new cases. The bad news is that all 100 counties are in the red, and although we're down, we're still quite high, well more than the spike that we had in July and August. As of today, 2,944 cases so far in the pandemic. And if you look back to August 10th, which was really the end of that summer spike, we've had a 400% increase in the number of cases. At that time, we were averaging about 2 to 3 new cases per day. We got up as high as 50 or 60. We're now around 37, 38. The first 1,100 cases by the end of November, the next 1,100 by the end of December, and we've roughly added about 600 to 700 this month already. But the rate does seem to be slowing, and I think we all anticipated 10 to 14 days after an event or a holiday is when we would begin to see the peak. So that certainly matches up with Christmas, New Year's, so that's all good stuff. The hospital got quite stretched a week or so ago. It's come down just a little bit as well, so that's all good news. I would also indicate that the first half of the month, the long-term care facilities had, out of roughly 550 cases, they had 47, so about 8 to 9% of the cases. So most of it's in the community. And in fact, in the past week, there have only been 7 new cases in the long-term care facilities. So again, that peak as well. On a little bit of a disappointing note, there are now, we've been tracking for the last little bit the number of people who aren't answering our calls, aren't willing to cooperate with health department, and there are currently 48 of those folks around. We hope that they've taken it upon themselves to isolate, and we hope that they've taken it upon themselves to notify close contacts, but we don't know. There have been about 130 or 140 of these folks so far, most of them over the last couple of months. I know that Garen filled you guys in on vaccinations, but just a couple of comments there. We are tracking from the time that vaccinations started in terms of the case counts. And I don't expect that we'll see much change in that for at least several months still. You know, once a person gets their first shot, it takes about 6 weeks through the second shot, and then 2 weeks after the second shot before they've reached maximum immunity. After the first shot, the thought is with the Pfizer and the Moderna vaccines that you get about 50% of what you're going to get. But we've already had cases of people who've gotten their first shot, and lo and behold, before their second shot, they get sick and test positive. So we know that it's still possible. And we know that even after a person gets their maximum immunity for the second shot, again, at 95% effectiveness, that still 5% will get sick. So it's still possible. And I think, although we're really pleased that people are as interested in being vaccinated as they seem to be, I think it would be a mistake to think that that's the end-all and be-all. And again, if we think in terms of the Swiss cheese analogy, that vaccine is a really important slice, but it's not going to do it all on its own. And that's the other reason that it's really important that we get our case counts down, because the lower the case counts are, the more effective the vaccine will be. I think we've had, maybe Garen touched on this, I'm sorry if I'm repeating, but I think probably somewhere between 3,000 and 3,500 people have now been vaccinated in the county. Did you touch on that? Yeah, somewhere between 3,000 and 3,500. On top of that are the staff and residents of long-term care facilities. Since that's being handled through a different prong, we don't have the numbers yet. That we hope to be able to get out of the CVMS system, but as Garen indicated, there have been some challenges with that. So somewhere between 3,000 and 3,500 through the health department and the hospital. Some amount of that on top of that with the long-term care facility staff and residents. So probably, if we sort of just estimate, probably close to 10%, maybe 8 to 10% of Haywood County has been vaccinated. If we take those 3,000 cases, that's another 5% of people who've been infected. So if you also add in the fact that perhaps there are people who didn't get tested when they got sick or had an asymptomatic infection, you know, we're probably in the 10 to 15, maybe 20% of the county has been exposed. So that's good. And as we continue to vaccinate, that number obviously goes up. That's the short and sweet of it. I think when I was last here, at least with Garen, we said that we'd be coming back in mid-January and we'd see what would happen. And I think, unfortunately, what was predicted is exactly what happened. We saw a spike after Christmas. It never came down. We see a spike after New Year's. Hopefully it is starting to come down, and that would be really great. And as we vaccinate more, that will hopefully even out, so that by summer, perhaps fall, we may be in a position in our community to really be able to take a breath and relax a little bit. But I think it's that kind of a time frame still. So happy to entertain any questions.
I was just curious, how many cases of flu have we had?
There have been very little flu in North Carolina and, in fact, in the country. In the week that ended December 19th, if I can remember this correctly, there were 5,000 specimens submitted to the state lab for flu evaluation. There's a surveillance network around the state of practices and hospitals that weekly submit data to the state, and they follow that. Out of those 5,000, there was one positive flu case. That was that was the end of the week of December 19th. The end of the week of, I think, January 10th, they had another 3,000 specimens, and out of that, I think there were 3. So there's been just, it's just, thank goodness, not had any flu around yet. Flu tends to peak late January, February, so we'll see if that actually comes to pass. The other thing that they're watching is that all the other respiratory viruses in the winter are all way down. And in Australia, of course, they're 6 months ahead of us, right? They have really contained their COVID. They had a very, very, very light flu season. They had a very light respiratory virus season. Now that they're starting back into that again, those are all coming back with a vengeance. So we may or may not have that to look forward to, but that's all the way for next year. We'll worry about next year. Let's get through this right now.
I just think it shows that wearing a mask, social distancing, and washing your hands that keeps the flu away too, probably. So.
Yeah, there's lots of conjecture about why this has happened, but no doubt, this stuff works. I think we know this works. And I think if you just if you look at the trends of the cases that we saw through Christmas, through New Year's, it's all the same thing that we've been seeing all along. Gatherings, somebody there pre-symptomatic, people not being as careful as they can be, and lo and behold, whammo. And that just continues to be the case. I think it's really important that people continue to be vigilant, because like I said before, if we keep the case counts down, the vaccine just gets to be even more effective. And when I say that, we know that the vaccine will protect individuals, but to protect the community, we need enough individuals. And I think, if we want to reach our goal of once again being able to safely gather together, it's going to take that community immunity to really take hold. So we're on our way. That's the good news. Just urge people to sort of stay the course and keep vigilant for now a little bit longer.
Anything particularly, so on the one that needs 2 shots, if the people don't come back and get the second one, other than just having a reduced amount of immunity, is there any negative side effects to only having the 1 shot on the 2-shot protocol? Yeah,
no negative effects. It's just they're not going to be as protected as they would be otherwise.
I would imagine there'll be some that don't make it for the second trip.
There may be, and we're running into the situation again of people who've been vaccinated, got their first shot, then they get sick. When do they get their second shot? And I think it bears noting that although the Pfizer has to be second shot on 21 days and the Moderna are 28 or vice versa, there's nothing written in stone that if it becomes day 29 or day 30 or day 35, it still works. So we're trying to figure out how to manage those sorts of people. But the answer to your question is there's no real downside to it. Yeah. I noticed that Santa's not here tonight, but I hope Santa's okay. Got their vaccine, so. Okay,
that's right.
Thank you very much.
Okay, thank you all for coming. Appreciate it. Great job. Our next order of business is the consent agenda. Does anyone have any questions on the consent agenda? I'll be honest with you, Greg, I was just curious, can you maybe tell us a little bit about the tax? Did you come up? I was reading your report, and I know are the numbers coming in about like last year, since it's, since through January 6th, would you happen to know that?
Sure. Just a little information here. We finished December at 72.91%. And last year, we were at 76.24, so quite a bit of difference there. What we're finding is that the mail is 30 days behind.
I've noticed that.
We're getting payments in today, for example, that have a November postmark, 15, 21 days out. So last year, we finished January at 92.29%. As of today, at 5 o'clock, we're 90.25%. So we've made up some of that lost in December, that first week of January. For example, we just got Evergreen's tax payment in today was $1.3 million, and it was postmarked December the 10th. So, a lot of this is the post office is behind. But right now, we've collected $36,534,000. Our total was $40,400,000. So we've got a remaining balance of about $3.9 million. I think with 8 or 9 days left here in the month of January, we should be right back to where our percentage was last year, which actually was one of the best percentages ever in the county. If you look at the 8-year average in December, for example, the 8-year average was like 73.84%. We finished 72.9. So we really, as far as that 8-year average, we weren't that far off. We had the highest percentage collected in October this year. We had the highest percentage in November. It was just December. I just think the mail, the UP, the post office has, today we did almost 1.5 million. Of course, 1.3 was Evergreen, but we'll take it. So I feel strongly that, even during this pandemic, that there are people paying their taxes. We haven't really used a lot of enforced collections at this time. We will be sending out the delinquent bills next month in February. So I feel better. I was a little concerned at the end of December seeing about a 3.5–4% difference. But this first 10 days of working days in January, we've really made a difference. So we're not that far off.
Right. Okay.
But it's just the mail. It's
I'd
crazy.
seen that low number, and I thought there was probably a good explanation for it. And it makes sense. I've noticed, I've gotten some, packages especially, because Amazon Prime isn't Amazon Prime anymore. Yeah. So it's just, and then you've got, everybody's mailing Christmas cards and then Christmas packages, and I can see how that would be.
So, it's 30 days at sometimes.
Yeah.
But I'd be glad to answer any other questions concerning that. We hope that we can continue to have these high percentages, and we're working with people. I want to stress the importance of communication with the office. We don't know how you've been affected by COVID, or we don't know what your situation is without you communicating with our office. And when you do that, then we're able to work with you or to try to put together a plan that is win-win for the taxpayer as well as the county. And we've waited on people outside the front doors from March to September. And now we're back to waiting on them outside again for the moment. And one interesting point was, we installed the drop box outside. We've had almost $700,000 dropped in that box instead of people coming into our office. So it was well worth, I think, the expense that was associated with that, and people have really taken advantage of it. We didn't have any long lines. We had one day of the hall being lined up. Other than that, we really haven't experienced a large wait time. And so I think we're very fortunate there. But we are waiting on people outside again, and it's what it is. Do what you got to do.
Okay. Well, thanks for that update, Greg. I appreciate it.
Thank you. My pleasure.
Okay, does anybody have any other questions for the consent agenda? Okay, I'll entertain a motion. We approve the consent agenda as presented.
So moved.
Is there a second?
Second.
Okay, all those in favor indicate by saying aye. Aye. Does anyone oppose? Okay, it's unanimous. Okay, we'll move on to our regular agenda. This is the next order of business, and number one is the request approval to purchase LED lights from CED Waynesville in the amount of $21,082 to be paid from fiscal year 2021 budgeted funds for the conversion of all lighting in the Justice Center. We have our Operations Director, Chris Boyd, here. Welcome, Chris.
Good evening, Chairman, Commissioners. I am here to request, as the Chairman read, $21,000 and some change to replace all the fluorescent structures in the Justice Center with the LED structures. I'd like to give you a little history on what we're doing there that shows the return on our investment. A couple of years ago, we were fortunate to get some money granted to Haywood County, not through our budget, but through the Department of Environmental Assistance, which used to be the State Energy Department, to do energy audits. That they were able to do 2 buildings for Haywood County. We chose the Justice Center and the Law Enforcement Center. So in those 2 audits, they looked at everything that was energy usage in the facilities, and in both cases, the number one recommendation for lowering the energy usage was conversion to LED lights. So we wanted to move forward with that. Last year's budget was a little bit different. Wasn't able to ask for those funds, but this year we have funds for the Justice Center and for the Law Enforcement Center. You are not seeing the Law Enforcement Center because that dollar amount does not cross the $20,000 threshold. So we submitted for that today as well to the County Manager for approval. So based on the energy audit, we're looking at about 1,500 fixtures in the Justice Center, 90,000 square foot facility. So the audit projected we would save we would have an annual savings of $15,000 on our electric bill for this conversion. So based on that, we're going to have a payback of about 1.5 years of this $21,000 investment. So just to give you the same number for the Law Enforcement Center, the cost there is only about $8,500. It's only around 55,000 square feet. It's served by Duke Energy, so we got a $6,900 rebate from Duke Energy for that facility, so therefore it's only costing the $8,500. We will realize about 1 year payback at that facility for our $8,500 investment. So as we continue to move forward, that's something that we want to look at to try to save money in the county budget. If we can move forward with these 2, and it's likely in next year's budget we'll be requesting the next largest facility we have at HHSA for conversion to LED lights.
Okay, does anybody have any questions?
I know that's a lot of numbers quickly and just a brief summary, but questions, I'm happy to answer those.
Just excellent payback. Good work there. I mean, anytime we can save that kind of money, it's well worth spending the money up front, so good job.
I know I personally, at my business, our lights had been up there fluorescent. They'd been up for 30 years, and last year I replaced them with LEDs, all of them, and the lighting was better and more uniform, and I even noticed a difference in my electric bill, when it came. So it pays for itself for sure.
The lighting certainly makes a difference. If you have an opportunity, go through our parking deck at night and see the difference that those LED lights make there. We just recently completed that project.
Right, yeah.
That's a great innovation. I know you were involved with the LED lighting in the arena down at the fairgrounds, and it's just made such a huge difference. The lighting's better, the power bill's much less, and it's just a win-win. Not only that, it helps the power company because they don't have to generate as much power to make those things burn. So it's a win-win-win for everybody.
And we try to replace any existing fixture in any structure with LED. If there's a fixture problem for 10 to 15, maybe 18% more in cost, you can replace that fixture with LED. So we even though it's one at a time, we do that in each facility when we need to replace a fixture.
Hate to convert everything over, do you know?
Yeah, we're going to use in-house staff. We have, as our interim facilities director, Tim Sisk, he's a licensed electrician. We have a couple of other folks that are electrician knowledgeable and have been able to help with this. We spent, all in all, converting the parking deck probably 5 whole days, but we had to do it intermittently, as we had time between work orders. So for this facility at 90,000 square foot, 1,500 fixtures, don't be surprised if it takes us, 30, 45 days to get through that process, a few at a time. We can't dedicate the staff every single day.
And the longevity on those lights is much different.
Far longer than a fluorescent. Yes, the
Yeah,
bulbs will last at least twice as long and sometimes more than that.
Any other questions for Chris? I'll entertain a motion. We approve item 2 of the regular agenda.
So moved.
Is there a second?
Second.
Any other discussion? All those in favor signify by saying aye. Aye. Anyone opposed? Okay, that's unanimous. Thank you, Chris. Our next order of business is appointments. I'll turn it over to Bryant. Go ahead, Bryant. You can do. Did I miss one? I'm sorry. I checked that. I don't know why. Okay, item 2 is to request approval of a resolution of the Haywood County Board of Commissioners authorizing the negotiation of an installment financing contract not to exceed $2 million and providing for certain other related matters. We have our interim finance director, Kristian Owen. Sorry, Kristen, didn't mean to jump over you there.
That's okay. I wouldn't have minded at all. Okay. But anyway, we have a quite lengthy resolution here, and I'll just summarize it for you. Okay. It's to give authorization to Bryant and myself to negotiate the installment contract for the school administration building and to submit application to the local government commission for approval. They have to approve of any debt transactions. Also to retain special counsel and financial advisor for this transaction and to provide notice of public hearing.
Anybody have any questions for Kristen? Go ahead, Brian.
Just to shine a light a little more on the public hearing, that will be at the February 1st meeting. We did a slight rule change a couple of months ago to where you don't have to vote for call to public hearing. We're still following the same timeline for this item. It will be in the Mountaineer tomorrow, and we'll have it at the meeting on February 1st at the 9 o'clock meeting.
Okay. Yeah, this way it speeds it up so that we're not holding up projects, especially projects that are time sensitive, which most of them are. Is there any other questions about it? Pretty routine. I'll entertain a motion. We approve item number 2 of the regular agenda.
So moved.
Is there a second?
Second.
Any other discussion at all? Okay. All those in favor indicate by saying aye. 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 Okay. It's unanimous. Thank you, Kristen. Okay, now, Bryant, you can go. Sorry. This is under appointments, and the first one is to request approval and appointment of James Rogers to the Clyde Planning Board.
Thank you, Mr. Chairman. We have an email from Joy Garland at Clyde, the Town Board of Aldermen are requesting appointment of James Rogers to the Planning Board. He'd previously served as alternative to the board. This is for a full member appointment.
I'll entertain a motion. We approve. We need to approve these separately, right? Okay. I'll entertain a motion that we approve James Rogers to the Clyde Planning Board ETJ.
So moved.
Is there a second? There was a second. Okay. All those in favor signify by saying aye. Aye. Okay. Go ahead, Brett.
The next one is appointment of myself to the Haywood Healthcare Foundation Board of Trustees and to the Investment Committee. pursuant to Section 6B of the Restricted Fund Management Services Agreement. Also is a reappointment of Commissioner Kirkpatrick to the Foundation Board of Trustees. My appointment's necessary because of the seat vacated by Julie Davis when she retired.
And we're reappointing Kirk, right?
She's going to stay on the board in a different capacity, but not in this seat that she previously occupied.
And we're also reappointing Kirk. Is that right? Okay. Anybody have any questions on that? Kirk, you want to do it, Kirk?
Yeah, I'll do that.
Okay. Kirk kind of shepherded us through this hospital thing, so he's very familiar with all that. Okay. I'll entertain a motion. We approve item 2 of appointments.
So moved.
Is there a second? Okay. Any other discussion? All those in favor indicate by saying aye. Aye. Okay. Anyone opposed? Okay, it's unanimous. And then number 3 of appointments, Brian?
The next is appointment of John Denton to the Center Pigeon Fire Department to the Firefighter Relief Fund. He'll be taking a position formerly held by Cody Parton. Cody has resigned that position with Center Pigeon, so this will be Mr. Denton's spot. He currently serves as the Deputy Fire Chief of the department.
Okay. Okay, does anybody have any questions on that? I'll entertain a motion. We approve item 3 of appointments.
So moved.
Second.
Okay, all in favor indicate by saying aye. Aye. Okay. Anyone opposed? Okay. Okay, then number 4, Bryant, go ahead.
The next is a little bit of reorganization from the Smoky Mountain Event Center to have staggered terms. So the first is an appointment of 2 people, Anessa James and Patricia Blake. Those are for 3-year terms. Miss James actually works in the craft world. She enjoys being able to organize events and showcase local artists. She thinks that tourism is a priority, but would also like to have things for the residents here. Ms. Blake has served the community for over 35 years with a family-owned food truck. She's familiar with the fairgrounds and wants to help continue it to be successful. The reappointment of Jonathan Jackson and Vicki Reese are for 2-year terms. Those are simply to have those staggered terms that I mentioned. And then Edward Bryant and Benjamin Wilder are 1-year terms, and those are reappointments.
Okay. And Tommy, you're on that board. Was this the board's recommendation?
Yes, this was just to do some housekeeping to get our continuity back in our board staggers. They were all going to come due at the same time. So we finally worked hard to get there and keep that continuity. So yes, that's what we were trying to achieve.
Okay, well, I appreciate you doing it. I remember I tried to do that one time and I didn't succeed. So thank you.
And I will make a motion that we approve those.
Okay. Is there a second?
Second.
Okay, all in favor say aye. Aye. Okay. And that we can do that for all 3, right? 6th Commissioner. Tell she's patting her foot over there. Okay. We don't have a closed session.
She need to come up and say anything, Kevin. You need to come up and say anything, Tracy.
Mr. Chairman, before we digress too far, I want to make a comment about the consent agenda. I don't know if any of you noticed this, but item number 5 on the consent agenda, I guess Doyle Teague really worked. He saw that grant available from Arnold Schwarzenegger.
Yeah.
And there is a letter from Arnold Schwarzenegger included in our packet from University of Southern California Schwarzenegger Institute. And it's a very interesting letter. His first paragraph said, "The United States gave me everything I have, and I believe it's my duty to repay the kindness of this country every day of my life. Everything I achieved, my bodybuilding success, my movie roles, my investments, my governorship, my family would have been impossible anywhere but America." And there's about 4 or 5 paragraphs, and it continues with the same theme. So Doyle Teague saw this. He made that offer, his personal foundation money. And there were several counties across the nation put in for this. And Doyle is to be commended for going after those funds, and it's going to help fund 11 poll workers for our elections. So my hat's off to Doyle Teague for pursuing that, and Robbie Inman, and also Mr. Schwarzenegger. So.
Yeah, and I appreciate you pointing that out, Tommy. Doyle had emailed me or texted me last night, making sure that I understood everything, and I thanked him for what he had done to look out for the county to get the grant.
Yeah.
I mean, those grants are out there, and that this is a county employee that works in the department, that department elections, and that saw it and went after it. So we appreciate that. And the election, this past election was one of the hardest for, I guess, election workers to work in with COVID and then everything else that's been going on. So we appreciate our election board staying on top of things and looking for ways to help our community. So I appreciate you pointing that out. Does anybody else have anything else tonight? There's no closed session, so I'll entertain a motion that we adjourn.
So moved.
Is there a second?
Second.
Okay, all in favor say aye.
Aye.
Okay, we're adjourned, and I hope everyone stays safe. Thank you.